starting the recording and enabling the live captions. I think that should be enabled now. Okay, so good afternoon, everyone. Thank you all for attending this panel today. My name is Maria Jose Gomez. I use she, her pronouns, and I am currently working with the Institute of the Environment here in Duluth. And this semester, we're putting together this panels related to the United Nations 17 Sustainable Development Goals, or SDGs. And we just think that it's very important for us to keep the conversation and action around the sustainability goals. To highlight the work that is being done in Minnesota and in Duluth around sustainability. I just want to say that this project was funded by the Institute of the Environment Twin Cities and the Rapid Response Grant through the GPS Alliance. So as I've said, we've been putting these panels together this semester to work with faculty to have these conversations that can directly benefit the different classes at UMD and anyone else here today that is attending this panel. The intention is to interweave these sustainable development goals into the curriculum, showcase sustainability work done in the area. So thank you, Dr. Dauner, for allowing us to set up this panel and for allowing me to work with you to put this together. I'm very, very excited. So just as I said, this conversation has live captioning and will be recorded and posted in the IonE Duluth website for future academic use. So we'll start kind of with the introduction from the panelists and some questions, and then we'll open it up to everyone to ask questions after that. And before we get started, I would like to say that we collectively acknowledge that the University of Minnesota Duluth is located on the traditional, ancestral, and contemporary lands of Indigenous people. The university resides on land that was cared for and called home by the Ojibwe people, before them the Dakota and the Northern Cheyenne people and other native peoples from time immemorial. Ceded by the Ojibwe in an 1854 treaty, this land holds a great historical, spiritual, and personal significance for its original stewards and native nations and people of this region. We recognize and continue to support and advocate for the sovereignty of Native nations and its territory and beyond by offering this land acknowledgement. We affirm that tribal sovereignty, I can never pronounce that word correctly, sovereignty, and will work to hold the University of Minnesota at Duluth accountable to American Indian peoples and nations. With that being said, I'll turn it back to you, Dr. Dauner.
Hi, everybody, and thank you for attending today, and thank you to you, Maria, for all your hard work on this, and to the Institute on the Environment in doing this as a service for faculty. It's been fabulous. And so I want to turn it over to our speakers. The way this panel is going to run today is that they're going to introduce themselves and talk a little bit about their work and what they're doing. And then I have some questions that the class has come up with, and so we'll start with those questions. And then there should be some time for additional questions. So feel free to post those in the chat or unmute and ask them at the end. And so I know my students have been encouraged to think of some questions over this week. So hopefully they've been doing that, and maybe they'll have even more today as they listen to the speakers. So we're going to start with Jamie Harvie, and would you go ahead and introduce yourself and talk a little bit about what you do?
Sure, I'm Jamie Harvie. The title on that page shares that I'm the Executive Director of the Institute for Sustainable Future, which is one of the hats that I wear. I do consulting work to healthcare and public health agencies around the country and around the globe. I'm half-time Executive Director of the Psychedelic Research and Training Institute, and I've authored some papers and textbooks around the intersection of environment, public health, and healthcare. That's probably good. That's probably good to go, unless you want me to dig deeper and share more, Kim, but can't hear you.
Trying to unmute myself. Yeah, we'll come back to kind of a little bit more about what you're doing. So let's go ahead. Catherine, would you please introduce yourself?
Sure. Hi, everybody. Can you hear me? Or
yeah.
Yes.
Okay, good. I think my computer just froze up, so I'm not getting any action on there. My apologies. Yes, hi. My name is Catherine Zimmer, and I wear a couple of hats professionally as well. I have my own consulting company called Zimmer Environmental Improvement, where I provide environmental improvement assistance to a variety of businesses, primarily in the healthcare sector. And then I also am the executive director of an organization called HEARRT Midwest. And HEARRT Midwest provides educational and networking opportunities to healthcare professionals working in the area of environmental sustainability.
Okay, thank you. Dr. Potter?
Hi, my name is Teddie Potter, and I'm a clinical professor in the School of Nursing at the University of Minnesota, where I coordinate the Doctor of Nursing practice in health innovation and leadership. I'm also director of Planetary Health. And my work has included establishing or founding, helping to co-found Health Professionals for a Healthy Climate. I teach a Grand Challenge course, which is Global Climate Change, Empowering a Movement. I was involved in helping lead the climate change interprofessional curriculum for our health sciences. And I'm very involved nationally with the American Nurses Association, the American Academy of Nursing, and the Planetary Health Alliance at Harvard, and the Global Consortium on Climate and Health Education at Columbia. Thank you.
Thank you. So let's dig a little deeper and focus on, what your work is, but also what healthcare management students need to know when it comes to the intersection of the environment and healthcare delivery, either at the organizational or country level.
Should we go in the same order, Cam?
Yeah,
or how?
That sounds good. So Jamie, why don't you start?
So I think about 20 years ago, I helped co-form an organization called Healthcare Without Harm. And its goal was to transform healthcare so that it was no longer a source of environmental harm to people on the planet. And I left that about 20 years ago after, and it's still in existence and doing great work. But I came to the realization that that the way healthcare thinks about health is very siloed. And for the most part, though changing, healthcare institutions really only consider what happens inside hospital walls. And they think of health through the lens of physical health, and they don't fully appreciate that we humans are a mixture of mind, body, and spirit, and that our health is a function of all the systems that we exist around us, our transportation systems, our economic systems, and quite frankly, our planetary system. And that if we are going to address health on this planet, we have to think of these as inseparable. And so for the last 10 years or so, I've been working to help elevate a really different framework for thinking about health. Because if most of our health happens outside of a hospital, why do we call a network of hospitals a health system, right? Our health system is our community and our planet. And so I've been curious and exploring why it is that we still remain stuck in thinking about health and healthcare as kind of the same thing when 90% of our health is from outside of hospitals. And I've come to the place where really it's a function of our worldview, how we see the world, whether we think the world is a machine and that is predictable, or whether we see the world as interconnected in its whole. And those two broad frameworks are really fundamental, I think, to how we think about health and transform the world.
Thank you.
That's my teaser.
So thanks. Going in order, let's hear from Catherine.
Okay, Kim, would you repeat the question?
Yeah, so as healthcare managers, what do students need to know about health and healthcare and sustainability?
Okay, well, I think I'm going to veer off a little bit from what Jamie said because he's got the big picture right on that, we often too often focus on kind of the clinical aspects of our healthcare and not look holistically at our health and actually consider the health of the planet as well, because those two are interlinked very, very tightly. And I'm going to talk a little bit about how you might do environmental improvement in your facilities on the ground. And I think first and foremost, you have to give employees the flexibility to do that and empower them to come up with solutions. And by the same token, it's important to have someone that coordinates it. So it doesn't, I'm kind of reflecting back on the questions, the initial questions about, is it expensive to do sustainability? And it really is not expensive to do healthcare sustainability. It's more a function of empowering employees because they see the problems and they want to do something about them. And then also providing some place for them to go with that information and catalog it. So there's a lot that can be done without spending any more money than you're spending on basically on employee salaries.
Okay, thank you. And Teddie, what about you?
Well, this is a semester-long course to address all the questions that you posed. Health, I see in much broader terms than our current illness management model. I really see it linked with health and well-being and definitely interconnected with the health of the planet. So there's a lot of intersectionality going on here. I don't want to discourage the healthcare management students, but our current system is immensely flawed and is imploding faster than we can even recognize. And so you're going to, by the time you graduate, you are going to be needing to lead change and lead the initiative of development and support of new models. We aren't going back to quote unquote normal. Normal, even on its very best days, did not serve the entire population well. COVID has revealed huge healthcare gaps and disparities. So we don't want to go back to what it was. We need to be building what's possible now. And I think Jamie and I were twins separated at birth because I could not agree more that we need to be doing upstream thinking and investment upstream in population health. We can no longer afford to be a rescue system, a system that intervenes in the 11th hour. We need to ease suffering before it occurs and be involved in working with the social determinants of health, the environmental determinants of health, and really positioning our population to be healthy. One of the things that I have done in the most recent years is I have brought my students to Cuba. Cuba has the most spectacular healthcare system I've ever seen. And I wanted them to see it in action in order to be able to come back and start to build a similar system here. And what Cuba does differently is they have a doctor-nurse clinic in every single neighborhood. And every person who lives in that neighborhood knows their doctor and their nurse, knows them from cradle to grave, and the doctor and the nurse knows their entire population. And this is the type of transformation that we need to see take place. Many Americans don't have a primary healthcare provider, or they never see them, or they don't even know the name of their insurance and how they would get started finding somebody. So we have massive redesign that has to occur, and the students are in a perfect place to be involved in that.
Thank you. I'm going to use that as an opportunity to push back a little bit on that first question, because I think one of the things, and this is that gist of that first question, I think one of the counter arguments that you'll hear from healthcare, whether it's true or not, is that that primary care may not pay as well versus services. And so I want to put it back to you all to, does that ever get brought up in the work that you all are doing? And then how can the future healthcare managers push back against that? And this can be free form, so I'll jump in, any of you.
Can you sort of restate that question, Kim? Because there's so much embedded in some of your questions that it's hard to kind of tease out.
Sure. So my students, when we talked about these topics, said, well, I think the first thing that a healthcare organization will respond with is, that's going to be terribly expensive, and we don't get reimbursed for retooling our healthcare systems to be more focused on primary care. So counter that argument, and so that they can counter that argument when they're in practice.
Well, I can jump in because I've done a lot of thinking in this space, and we talk about this all the time, in that the current U.S. healthcare system is, if you look at the G10, G12, the largest economies in the world, and look at their healthcare systems that are on a comparable par with ours, what we provide, et cetera, we consistently come in last for our impacts and outcomes, consistently, of all the matching sort of economies. We pay 2 to 3 times what all the other nations pay for quality healthcare, and we come in last with outcomes. So there's a problem with our design, not with the quality of our providers, not with the quality of our innovations and our pharmaceuticals and all the things that we have, but with our current model is very, very flawed. And so we need to be thinking about a model that helps our citizens have optimal health and at decreased cost. So that's how I would counter this, is our current system is not working. It's based on a business model, so that you are looking towards charging for a product to be used, or a service to be used. Whereas we need to be encouraging our payers to be paying for prevention. Not your patients did not go to the hospital. Your patients were well managed with their diabetes. The patients who have long-term cardiac problems come into the clinic but don't need emergency or intensive care solutions. That saves money. If money is what talks to people, prevention is cost effective. But you need to be able to understand that and put dollar value to what does it involve to preserve the health of your population.
I'll follow up on my twin here, but I'm actually a Canadian, and so I've lived half of my life in the Canadian system. That's what I was trying to tease out in your question, right? Is that we try to look at sort of a disaggregated part when we have to look at the health system as a whole, which is bigger than the hospital and it's bigger than insurance. In my work, we hosted a conference for 3 years, which we called Commons Health, and it challenged people within the health space to think about a community as its entire health system, right? And so what would it look like if you brought business leaders and those who created the transportation systems, those creating the food systems, to be involved in a holistic redesign? And so it's like trying, some of the questions that were asked were, I was going to say, it's sort of the wrong question, right? How do we create health, right? And so you have, so if we look at the community or state level, we have to bring, I'm not saying this would be easy, but we have to think of health more broadly. But our brains are stuck, right? Our brains are stuck. And in some ways, I kind of wonder if we need a complete collapse of our system for us to be able to recreate anew. But we see exciting models. There's a NUCA system of care in Alaska. There's other models around which are thinking holistically about the model. But when we look at climate change, we have 9 years left, or is it 8, to completely redesign the systems that make up civil society if we're going to address climate change. So it's the exact same thing. We have a design problem, and you're not going to fix it by changing a window or who pays the electrician to wire the air conditioning on the 40th floor when the foundation is about to collapse. Right. So that's the state of affairs. And so when I think of, like healthcare business majors, or I forget if it's the exact terminology, I think of maybe our healthcare business majors are going into the transportation sector to say, oh my goodness, why are we creating roads or transport ways that don't promote active living, right? So I would ask and challenge your students to start thinking about healthcare as something that's bigger than the hospital itself, but more broadly. So it's really a question of how do we put our economy in service, right, to the sacred, to health, versus the other way around. We're putting all these things in service to the economy. And we're never going to get to where we want to be, right, as a society. And quite frankly, we've got about 10 years to figure this out.
Right. I just want to make sure, Catherine, if you want a chance to respond, I know you're on the phone, so it can be a little bit difficult to chime in.
I need to reflect a little bit on what Jamie and Teddie have said. I will just say that I think I concur that we do need to change the model. The Affordable Health Care Act actually does work on that to some extent, where there's suggestions of the healthcare system having to look more closely at population health and look at outcomes. And I think that's also where we can get traction in the environmental sustainability arena right now to some extent, although I also don't really work in the space where it's more systems thinking. I'm working more in the space of kind of on the ground, what can we do, what can we implement, and how do we integrate that kind of thinking, that holistic thinking of beyond, this person comes in with diabetes. Why do they have diabetes? What were they exposed to? What is happening in the external environment that is making them ill? And how do we move upstream on that? So, that's about all I have to say about that.
Sure. This class actually read earlier in the week an article about how the UK by 2040 is going to aim for zero net carbon emissions using many of the strategies you were talking about. Do you want to reflect or comment on that at all? It seems difficult to translate that to the US context, and curious as to your thoughts.
I didn't. Were you addressing Catherine specifically, Kim, or because I've worked and I hosted a global sustainability summit in Cambridge a couple of years ago, and so I worked with the UK health sector, and I think if you go to their the NHS sort of report, they have a whole program on their sustainable development unit, the SDU, I think it is. But of all the health systems in the world, they're the only ones that have done a comprehensive footprinting of their healthcare system. And it gets interesting, right? When you tease it apart, I think many of us in this virtual room would think of healthcare is like, oh my goodness, yeah, it's highly energy intensive with the MRIs and CAT scans and all that sort of thing. But when you start moving it out and looking at the embodied energy, the pharmaceutical footprint is actually on par with building energy, right? And actually greater. And so right there, you start to see that healthy people are a climate prevention or mitigation strategy, right? And so there's lots of really rich data in there, but they are looking holistically at healthcare delivery and looking, for example, and understanding that transportation costs are also a significant driver of climate change within the NHS. And so what does it mean about moving towards, this was pre-COVID, but moving towards virtual visits and or having, looking at a patient, not only staff, but patient transportation and geographic access into their system. But I'd highly recommend that folks look at the NHS climate footprinting and tease out, because there's a lot of learning, but the benefit that they have is that they have a system that is which is run for the benefit of their population. That's what the national health system is, and it's the same as in Canada and Cuba and France, and different but similar models versus a sort of private or not-for-profit but not government-run system here in the U.S. So there are a lot of benefits there because there is a collective interest in minimizing costs and supporting health as a whole instead of health as an individual.
And again, not surprisingly, in my role as director of planetary health, I zoom out quite large here and think of the health impacts, not just of climate change, but all the disruptions of our natural systems. We do know now, according to the World Health Organization, that we're seeing about 150,000 excess deaths every year related just strictly to climate change. But then you start to add into that the disruption of natural systems, the loss of biodiversity, and we are seeing a rise of zoonotic diseases and pandemics like COVID. So when you start to look at the economic costs of COVID, the human life costs of COVID, the suffering of whole cultures because of COVID, the cost of inaction is incomparable to the pennies that are saved on buying a cheaper product that's less sustainable, or keeping the lights on that's easier than not using things wisely. The thought of the human lives that are going to be lost because of the current actions that we're taking. And I haven't even begun to mention the loss of our pollinators, which is going to be a disruption of our food systems. We're going to see massive malnutrition and also migration, human migration related to places that are no longer livable. So if you're the organization you're stepping into is saying we cannot afford the costs of sustainability, you cannot afford the costs of inaction. You absolutely cannot afford that. So you got to be getting involved now. And there's some wonderful healthcare systems locally. Gunderson Healthcare is doing a marvelous job on their energy, on their decision making, the how they provide care, how they're using their whole plant, their whole system sustainably. Mayo is involved in some things. Health Partners is involved in some very nice work. So you don't have to go far to see some exemplary models. And I realize that this is Jamie's area, but I had on my little notes mentioning healthcare without harm and practice green health. So, and clean med, upcoming conference, annual conference that helps health professionals understand how to get a grip on this. I also I'm going to just share my screen real quickly because I want to do a promo here for the Planetary Health Alliance Conference that is going to be April 25th to April 30th. This is an annual conference. It's an international conference of planetary health experts. It brings together the economists, the policy people, the agriculture people, the conservationists, the healthcare people, to acknowledge that the health of humans depends on a healthy planet. This conference this year, because of COVID, it was going to be in Sao Paulo, Brazil. It is virtual now, and it's free. So those of you that want to learn more and be exposed to incredible experts in this developing and emerging field, I would highly recommend that you register to participate. Even if you can't see everything, the cost is not prohibitive, so you can hear some of these speakers speak.
It's tough for me. I recognize that Catherine and I have known each other for quite a long time. I recognize she's on the phone, and as we, in that slide that Teddie shared, there was the term the great transition, which is sort of the term that's being used to roughly describe the transition from sort of that's the way I interpret it, from mechanistic thinking to sort of holistic thinking, and the transformation and really reconnecting to ancient knowledge, that we are intimately connected to the health of our communities and the planet. And so Catherine's in the midst of trying to do what can be done currently in our current model. So, it's challenging work. I finally find it really hard because it needs to be done in the short term. And it helps inform us that there are actually, tweaks that can be done. But where was I going to go before that? I think, I'm of now the age. I've got gray hairs, and I have some kids who are likely the same age as those on this call. And as a parent, and as for someone who has empathy, right, for those of you, right, in your age group that are struggling with some of the things that we've brought up. That what's it mean for species loss and pollinator collapse and so forth that Teddie brought up. And so the problem that we Western, and especially I think Minnesotans, I grew up in Quebec, right, where we sit and hug and emote a lot. It's kind of like Cubans, right, Teddie, right, a little bit more emotive. But the problem is that we keep this to ourselves, right? And you can just Google the term solastalgia, which is a term that's popping up in the literature and even mainstream media, which describes a sense of loss of place, and the term ecological grief. And so there was a great report that was put out by Eco-American, the American Psychological Association, maybe about 3 years, maybe 4 years now, which helps explain a little bit more or digs in, and it would be another great resource. But the idea is behind that is that we have our brain or amygdala steps in. We have this flight or fight response, right? But it's also, we can freeze. And some of these issues are so overwhelming. We are talking about existential threats. And so how do we get ourselves out of this freezing, right? Where we just shut out this information, because these are, no one in prior generations have really had to think about what does it mean for the fate of humanity. And so I would offer that those on the call, and it's a process I engage in myself, is to do some of that inner work that's needed, because unless we change our inner selves, we're not going to change the outer selves, right? And what that means is our culture wires us for individualism, right? The Declaration of Independence. There's no such thing as independence, right? We're all internet connected, right? And so there are ways to address and even sort of acknowledge that grief that we're feeling. And I think that's a great place to help us start to move forward in the transformation that we're needed, but to not acknowledge that we suffer in some ways by either shutting it out or feeling stressed or having anxiety, does us a disservice to the change that we need. And I think by engaging in practices such as meditation or other types of reflective processes, it actually frees us to engage in the broader outer change, right? Outside of our inner brains, outer change, in a ways that allows us to fully participate and be fully present. And so it's something that I think is also key, that it's not just about reducing, turning off the lights or reducing instead of reusing, but it's a collective call to action about internal transformation as well.
Good thoughts there, Jamie, and I concur with you that you do have to start to absorb this internally to give yourself the strength to move forward in changing the system. And I think COVID, despite the, just kind of the grief and the societal upset and the economic upset that's been associated with it, has also provided opportunities. For one thing, public health is much more at the forefront and has shown its benefit, as well as in my conversations with healthcare systems that are currently working on the ground to at least reduce their environmental footprint. And as Teddie alluded to, some are actually really, like Gunderson Lutheran in particular, really working to how to change how they provide care, and looking at different models. And I see that also with COVID, local healthcare systems, mHealth Fairview, Alina, Health Partners, Mayo, are all too looking at, how can we do things in a little bit more aligned with the national health systems in the UK? Can we provide virtual visits and not have so much transportation? Can we look more closely at outcomes, and how do we prevent that kidney patient from moving from some slight kidney disease to ultimate kidney failure? What are we doing to not just treat them at the moment, but prevent them from getting sicker, basically? So there is some movement, but I would say to this group, as potential healthcare managers down the road, it's really crucial that you are participating in panels such as this, where you have some really progressive thinking going on, and it's going to provide you the background to think in such a manner as you go forward, because you guys are really going to be at the helm of the organizations that you work for, and have a really super opportunity to integrate public health and environmental health in the organizations that you will be working for. So kudos to you.
Thank you. Instead of me asking another question, I think because we have about 12 minutes, I'd like to hear what questions the audience has. So students and guests, feel free to type a question to the chat, or I'm looking for raised hands and I don't see any, or just turn on your mic.
We're all pretty friendly, right?
Yeah. Looks like Grace has a question.
Yeah, so as Jamie said, we have like 10 years to sort this all out. Given all of that, how do you keep a positive mindset doing the work that you do against pretty large odds?
I personally have a meditation practice that I engage with every day, and there's if you've never done that, it's kind of a nice. There's a fun little free app that you can use called Insight Timer, and it just takes you down there. My wife's a physician and recommends it to her patients as a nice way. That is kind of one way of doing it, and there's complexity science, right? Which tells us that, well, we walk in uncertainty every day. And so it's not we have 10 years for sort of massive societal disruption from climate change. I push back on this idea that we have to save the planet, right? Because the planet's going to be here. It's just doing what it's doing, right? The planet is taking care of itself. And so I use a meditation practice. I use a gratitude practice. There's a website that I've helped put together called One Sacred Earth. We've done, maybe this whole class could participate in it. And what it does is ask people to share a gratitude. Kim, you and I can hook up afterwards, but organizations from around the country have been using this, and what it does is it crowdsources some gratitude. But what these practices do, right? They move you from the mind, which is where most of us operate, especially in the business and the sciencey world, right? It moves it from our brain to our heart, right? And that's an important distinction about how we make decisions to move forward. And so, do I get overwhelmed at times, Grace? Yeah, maybe. But I see my work as sort of being channeled from something bigger, and I can only do what I can do. And I see that there are others like yourself and Teddie and Catherine, everyone on this call, right, is engaged in this. So we're part of a community of practice that is making some spectacular change. Maybe it just feels like we're sort of spinning our wheels a little bit. Do I know we'll succeed? No, but I know we're trying. And that's sort of where the joy comes from. The joy for me is being on this panel with all of you. And so I think it's about remembering to what you're grateful for, seeing the joy, the piece of joy in the world. But doing a practice is really important, really important. So I don't know if that helps.
And I'd like to jump in and just echo Jamie's the statement that it's important to not block your feelings. So if you're in the grief phase, I found that if people ignore their grief, ignore their loss, and try to keep it tamped down, they use all their life force energy to that task. If you can walk with others in particular, to allow yourself to experience the solastalgia, the sense of grieving what we potentially will lose, then that energy becomes available to you to do work. So how do I stay in this over time? How I stay in this over time is to have gone through, hit the depths, and are coming out and rising up. And I will say to all of you, I've been in this work a long, long time, and I've never been so hopeful. Why? Because the whole system's collapsing. We were running around trying to put a Band-Aid on a hemorrhage. First we'll fix this, and then we'll fix this. And inside of me, I just knew this is not going to work. This is not going to make it. Now the whole thing is crumbling. And we have to do this great transition, which is transforming everything. Our agricultural practices, our consumption patterns, the way we educate. The university is looking at itself right now saying, how do we redesign? Transportation, everything has to be redesigned. So it allows us to build a world that's more equitable and is possible and will serve more people. So I am very, very hopeful. You also need to find your people. Don't do this alone. Work with others. You know, gather around and be in the midst of others. So when you're sad, they're up. You can be with them. When they're sad, you can be up, and you can walk through together. I'm going to share just very briefly. Not that I'm, pushing a product, but we started the Nurses Drawdown. We found that the drawdown solutions, which are the evidence-based, science-based solutions, are extremely effective, are wonderful, but they don't get us to where we need to go unless they're scaled, unless people adopt them. So nurses around the world have adopted 5 key areas of action that are based on drawdown science to draw down greenhouse gases very quickly. Why nurses? Because we're the most trusted source of information. So we are talking to patients, organizations, healthcare systems about drawdown initiatives. And these things that we've chosen, such as plant-based diet, educating girls, preserving our forests, when we do these things, not only do they help the planet, but they help human health. So there's a co-benefit aspect to that. So if I can leave a parting message to the students, it's now is your time. You are lucky to be ready and poised to transform the system right now. It's going to be hard. It's going to be scary, but we're not going to do it alone. We're doing it together. So find your people, find the conversation, and realize that we're all rolling up our sleeves right now to do this great transition.
Thank you. Catherine, what would you like to add to that?
Well, again, I have been doing this work for a very long time as well, and I actually came out of healthcare. I worked in the clinical lab and saw the problems back, and this was I actually left the lab in the early 90s, and because I saw that we had problems with connecting the activities that were going on in the hospital that I was working in and the greater world, and I thought there's something awry here. And so I have been working now for the last 20-some years on helping healthcare really become healthcare and connect more with the natural world that's so important to us. And for one thing, I'm encouraged. It's been, like I said, 20 some years, but I'm encouraged by the number of people in the healthcare system now that are more engaged. Healthcare Without Harm continues to work strongly. Practice Green Health, which I was on the ground actually to help start, is a very strong organization, and there have lots of participation from healthcare facilities and healthcare systems around the nation. And then we have folks like Teddie that are training next generations, and Kim as well, folks that are really starting to make this more systematic and bring more people to the fore. So that gives me hope. And then I also just kind of have my own personal mantra of, I think it was Gandhi that said this, and I'm paraphrasing, but it's basically when you stop trying is when you start dying. And I have always felt that I will do better for myself personally if I'm engaged in trying to make it better and walk the talk. So that's kind of how I keep going. And I also concur it really does help to find your tribe or find your people, because there are going to be days where you just are sad, and those people will help you get through those periods. But again, we, as Teddie and Jamie were saying, this is also a huge opportunity for transformation.
It is certainly encouraging to hear such words of hope from the three of you. And I don't see any more hands up or chats. And so we've got 2 minutes. Maria, I want to thank you again for your work in putting this panel together. This was a tremendous resource for faculty. And Jamie and Catherine and Dr. Potter, thank you for donating your time and being here today to inspire future healthcare leaders. It was fabulous to have students be able to hear that. I see Teddie has put a chat with the Planetary conference, and actually what I was going to do was to reach out to all the speakers individually and ask for some resources that I could send to my class. I wrote down some here, so students of mine look forward to getting that in your Monday email from me. Maria, is there anything you want to say to wrap up?
Well, I just want to say thank you to all our panelists. Thank you for coming here and sharing your knowledge, your expertise, your point of view with everyone. I think, like, as I mentioned at the beginning, continuing these conversations and how to make every system in our world in a way more sustainable and more equitable is so important. And as someone who personally is not in the healthcare world whatsoever, it's very empowering and interesting to hear these conversations. And I hope that, like, I also want to encourage your students, Dr. Dauner, if they want to come to our future panels. We have panels in engineering, in communication, in biology and climate change. So just really start thinking of this more of like as a integrated group of systems that I hope that here at UMD we can keep highlighting, keep working on. So yeah, just thank you for letting us work with you, and this was great. And thank you, Jamie and Dr. Potter and Catherine. It was great.
Lovely to be here with all of you.
Enjoy your weekend. And
thank you.
If you need me, I will stay on. As long as there's somebody on this call, I'll be here. So.
All right.
Thank you all for the opportunity.
Thank you for the invitation. Bye,
Thanks, y'all.
Bye. Bye,
Thank you.
Catherine.